everyone. This is Deanna Minnick. Welcome to the Detox Summit. Today we have a very special guest, Dr. Michael Stone. Michael Stone is a family physician who practices in Ashland, Oregon, in a functional medicine practice with 2 nutritionists and 4 other primary care clinicians. Along with his spouse, Leslie Stone, who's also a physician, the dynamic setting focuses on many aspects of life and health, starting with preconception through pregnancy, childhood, and the elder years. They both approach health and disease with the positive knowledge that how you choose to eat, move, sleep, and have relationships turn on and off genes epigenetically within hours and change life. Dr. Stone has been with the Institute for Functional Medicine as adjunct faculty for a decade and has been integral in helping develop programs in nutrition evaluation and treatment, along with the Functional Medicine Matrix and teaching and lecturing nationally and internationally. In fact, he just got back from South Africa. So Dr. Stone's specialty, I would say, since I know him a bit through the Institute for Functional Medicine, is what he does par excellence is really focusing in on nutritional physical diagnosis. This is the stuff that all nutrition professionals want to know, as well as physicians. How can we tell what's going on in the body by actually looking at ourselves, looking at our skin, at our eyes, at our hair? And what he's also, I would say, expert in is this whole area of methylation. And so for those of you who don't know what that means, we're going to go into that a little bit further. So welcome, Dr. Stone, to the Detox Summit.
Well, thank you very much, Deanna. And I have to congratulate you and what you're doing, because this is such an important area that helps drive our health and our disease to be able to understand detoxification and how our body can use the things that are around us to improve its interaction with environment and the things we eat. So congratulations. This is quite an endeavor.
Well, thank you. And it's such a pleasure to have you as part of this. Knowing what you do a little bit more, I couldn't help but have your expertise be part of this movement. I really see this as a movement because I can imagine that when you went to medical school, you probably didn't hear much about toxicity and detox, did you?
No, we really didn't. And, our story in medicine over the last 30 years is just a greater understanding of the intricacies and how dynamic our physiology and our health can be. I had somewhat of a unique background because I actually did my undergraduate and graduate work in nutrition before medical school. So I always say that I washed my medical school training over my nutrition knowledge. And so with the average number of hours of nutrition education and medical school and residency being somewhere less than 20 hours, after having that background and understanding, working with WIC programs, doing some overseas work, you ask different questions when you look through a different lens. That actually led me to a greater appreciation that all of us, whether physicians or not, are all born with the same senses that Hippocrates, one of the great physicians of ancient times, had. And that's our ability to see, hear, touch, feel, and sense our health. And so part of the things we do, and part of the things, as you noted, we do, is we try to help people see more during the physical exam that helps divulge more about their history. And I'll just say one last thing. Both at the end of my first year of medical school, Leslie, my spouse, and I were working on the Thai-Burma border at the headwaters of the River Kwai. And we had a hand crank centrifuge, and we had enough fuel to generator 2 hours a day. And we would fire that generator up if we had to do an x-ray. And what we had to do, what I was tasked to do, is do a nutrition evaluation of over 250 children in orphanage. And I was asked to do a physical exam and see if I could identify nutrition sufficiency or deficiency and document it, having the children do food frequency, looking at different different sizes of portions and identify how much they got to eat. And, from that, with a hand crank centrifuge and hang your weight through a dowel scale and just using our hands and what rudimentary tools we had, we were able to see and document nutrition deficiency and insufficiency. And because we were able to do that and compare it to the people in the area, in the village, and in the country of Thailand, we were able to get funding for a nutrition program for that orphanage for 5 years. So at the end of my first year of medical school, I realized the power of observation and how it could change lives and change health opportunity for children. And I think that has been such a foundational experience for Leslie and myself in our clinic, that we just don't give up on our desire to see more through the physical exam and understanding what people are eating and knowing that it markedly affects their health.
Wow, what an incredible journey in terms of reviewing and really being a catalyst for getting that program funded and doing so much great work with the children. I feel like in medicine that physical diagnosis is a lost art. How often is it you go into the doctor and within 18 seconds you've got a diagnosis? There was really no checking you over, or if there was, it was very brief. And so I feel like we've lost this art, and the beauty of what you've done through functional medicine and the Institute is you've brought that to the forefront. And I'm really glad that you have, because you have this very eclectic background, a synergistic background of nutrition combined with your MD. So perhaps you can take us, the listeners, down the path of exploring our physical bodies as it relates to toxicity. What are some things that we should be looking for?
Well, I would love to do that. The first thing we do is help people understand their timeline. You ask them, when was the last time you felt well? And most of us can identify a time when we shifted from feeling well to not feeling well. And if you're one of those people, then the next question we have is, have you gained any weight that seems disproportional recently? Do you seem to be holding on to a little more fluid? So just getting an idea, has the weight changed? Well, why is that? We know that a lot of the toxins change our ability or change the amount of electrolytes, minerals we need, like magnesium is example, or potassium is another example. And if that's out of balance, then what happens is we get a little more fluid, swelling. We have the sock lines, at our ankles. Or if we stand for a long time, you may have a little more swelling. Or if you push on the skin on the front of your legs, you can have some pitting. So that's one of the first things we do is we have people get on the scale and see if anything changed. But then what's next? Well, the next thing is in shaking the hand is the hand warm? Is the hand cold? So are you a person that has that kind of clamps down? So when your hands get cold, they get really cold. Do you have poor circulation? Well, then we start thinking about maybe some of the heavy metal issues. And why are our blood vessels not so flexible? And are they not so flexible because we grew up in the age of leaded gas and we have stored a lot of lead? Or do we have a lot of cadmium from fish? Or do we have some extra mercury? And is that affecting things? Then you step off the scale after shaking your hand and we go into the room and then we do the waist and hip measurement. Now, I know that can be somewhat unsettling, but if you go ahead and put your long finger on the top of your hip bones in your right under your armpit on your hip bones, and then put your thumb at your 12th rib, and that place in between, the equidistance in between, is your waist. And if you measure your waist and then you measure your hip, when you move your leg and you can feel the greater trochanter, your hip bone on the outside of your hip, and you measure there, and your ratio is greater than 1, then we think about, if it's greater than 0.85 for a female and pretty much for a male too, a little more for a male, then we start thinking about, you have extra fat. So why do you have extra fat around your waist? Do you have it because you're inflamed? And what's causing you to be inflamed? And so then we start thinking about, toxicity issues around that.
Mm.
If you are holding on to extra weight and your hips are bigger than your waist, then that's pear-shaped body, right? Well, pear-shaped bodies classically hold on to toxins or have endocrine issues, hormone issues. And what's causing the hormone issues? So just doing those simple things help us begin to think about toxicity. Then we go to the hair. Is the hair coarse? Does it lack its luster? So are you getting enough protein? Do you have enough sulfur protein in your diet? And if you do, if you don't have enough, then your hair is going to be coarser. Or if you don't have enough protein, your hair is going to be coarser. If you don't have enough zinc, your hair is going to be a different color. If the toxins are requiring you to have more zinc, it's going to be a different color.
What color would it be if we didn't have enough zinc? That's really new for me to hear that. If we added zinc back in, would it just change color pretty readily then?
Yes, actually, if you're a dark-haired person and you're not getting enough zinc, then it will get lighter, and it can even get more of a reddish, much like when you don't get enough protein. If you have too much zinc and not enough copper, your hair will get whiter. If you have not enough vitamin C because you've had so much exposure to toxins and you have to increase antioxidants, then find that water. Must have been a group of pollen that just went through or something.
Whoa.
Just tightened me right up.
Well, maybe the throat and something about our voice and toxicity. Maybe we could, if there's something there too.
Yes, there is. And that relates actually to thyroid function. Mm-hmm. So if your thyroid levels are significantly lower because you're not getting enough iodine, because you have too much chlorine or bromine or fluoride, then your thyroid levels will drop and people start losing their voice or they start getting a hoarser voice. So you can, almost everything on the physical exam, you can see some toxicity signs in the presence of toxicity. Are you feeling your feet as well? Do you have numbness or just feel like you're walking on sandpaper? You know, the association of arsenic with neuropathy, with not being able to feel your feet, or the toxicity of sugar, high blood sugar, leading to nerve problems so people don't feel their feet as well, are common causes for feeling like you're walking on sand, or you're just kind of losing that sensation of your feet. So almost every single thing on physical exam, you can see toxicity if you know how to look.
You know, I'm just wondering, you just gave us so much information here. I just want to do a quick recap. So you're almost describing when somebody comes in to see you for this physical exam, they jump on the scale. You can already tell a lot of information based on swelling of the body. You're shaking their hand and assessing their circulation, which in part can be due to heavy metal toxicity. You're looking then at waist to hip ratio, which if it's too high, that could denote some issues. And you mentioned something that might be novel for the listeners. Many times we hear about the apple body shape, which is more adipose tissue or fat in the middle of our bodies, right around our belly. But you mentioned a new kind of a body shape that I don't think many people know about, which is the pear, where we have more weight in our hips and buttocks. And what I'm hearing you say is that there's more of an association with toxicity and this body type. Let me just do that quick recap. Is that correct?
That's absolutely true.
Okay. Right. And then we've got hair, which you've gone into that beautifully. Then you mentioned the sensations in our feet. And Dr. Stone, one of the things that I recall just from literature on toxicity is that our neurological system is one of the first systems to be impacted by toxins. Is that true? Is that why we're seeing some issues with circulation and feeling?
That is true. And you know, when you think about areas that are impacted by toxins, it's going to be any tissue that turns over quickly. Think the lining of your mouth, thinking your skin, thinking hair, thinking nails. But it's also going to be anything that requires a lot of energy. Mm-hmm. And most of the toxins affect our cells' ability to harvest energy from the foods, from the protein, from the fats, from the carbohydrates. So one of those tissues that is most susceptible are our nerves. They're the longest cell in the body. You think about the nerve that starts at the base of your spine and all the way that goes down to the end of your toes. Depending on how tall you are, that can be a really long nerve. That can be 3.5 feet long in some people.
Mm-hmm.
And that requires so much energy and so much good nutrition to stay healthy that anytime you have toxicity, whether it's pesticides or whether it's heavy metals or whether it's persistent organic pollutants, any of those markedly increase or markedly decrease nerve function. High blood sugar changes our vitamin B requirements and changes our mitochondria's ability to make that energy to fuel and drive the cell. And so what happens is when you start losing energy production in the nerves, it affects its function all the way down to can it release the neurotransmitters to help you communicate with your different nerve networks. And so you're exactly right that toxification, whether it's from too much sugar, too much heavy metals, too much organic pollutants, too many pesticides, are going to affect nerve function. And so is it going to affect just your really small nerves that help you feel? Or it can affect the larger nerves that give you muscle strength. So you start thinking about large fibers or small fiber nerve problems in response to these different pollutants. And the great news is we know with high blood sugar, sugar is a toxin, that if you have nerve damage, you can intervene and grow new nerves with the right type of activated vitamins. We know that if you've had nerves that have lost function because of chemotherapy, toxins from chemotherapy, or from heavy metals, we know that when caught at appropriate time and with the right nutrition, you can actually restore nerve function. And that's true for the nerves that go to your fingers and toes, but that's also true for your ability to think if your memory and your ability to process has been negatively affected by the toxins. The other one that I will say that we see all the time in our practice, and that is the immunotoxicity that comes from when you have an immune reaction to wheat. And so wheat in itself, and I know other folks are talking about, but wheat in itself can trigger the immune system to cause changes, antibody changes that affect nerve function. So it's really important to be able to step back and to first check to see, simple questions. Do you stumble a little more at night when the light's off? Is it because you have trouble seeing, or is it because you don't feel your feet as well? And so doing these little things, have you noticed change in your handwriting? That's why we have people write frequently, so we can actually compare it in their chart to writing 10 years before. And you'll see the changes that occur. Has your smell changed? We know that zinc insufficiency, or we know that breathing in fumes that have lead or some of the other heavy metals will alter your ability to smell. So these are all clues that we can take advantage of every day if we just ask, look.
Well, it's almost like being a physician means you have to be a detective. And if we are empowered and really tuned into our own bodies, we can start getting these messages. So I think that this is so beautiful what you're saying, because it really shows us the power of being connected to all of the changes in our body, whether it's, like you said, the handwriting or the nerve function and how we're walking and our muscles. And so I think that this is really going to open up a lot of people's eyes, because we kind of know that we might have some changes, but we may not know why our body is changing. And to think that there could be a toxin connection might be a new way for us to think about our bodies. So, Dr. Stone, I'm wondering if we could also talk a little bit, since you and your wife, again, two really powerhouse physicians in one practice here, along with a number of other practitioners. Maybe we can talk a little bit about how these toxins impact things like conception and the growth of a baby, and even postpartum, and how a child is impacted by these toxins. So maybe you can talk a little bit about that for us.
Well, there's no time in life, it seems, that people are more willing to change and live healthy than they are when they're either carrying a child or their significant other or spouse is carrying a child. Men are willing to stop drinking caffeine, start exercising. Women are willing to change their diets. People stop smoking. They start being far more mindful because there's no greater blessing than being able to carry another child that's growing inside of you. So one thing that I will say, I've delivered about 2,000 babies. I stopped delivering babies in 2000. Leslie continues to deliver babies, and she's delivered nearly 5,000 babies. So between the two of us, we've delivered a small town.
Wow.
And we know that there are many things that are changing in how the health of children today. We know that there's more childhood obesity. We know that autism is taking off. And there was a foundational study that came out of UC Davis, Journal of Epidemiology, that suggested a couple things. This is really the melding of our growing knowledge of our genetic uniqueness by understanding our single nucleotide polymorphisms, our SNPs. Everybody has tens of thousands, hundreds of thousands of these SNPs. But what they did at Davis is they wondered, are there SNPs that are associated with increased risk for autism if there wasn't adequate nutrition early? And they did a population study, and they did all this testing on these mothers and babies. And they found if the mom had this one SNP that allows her to activate, that changes how she activates her folic acid. Now, folic acid is a B vitamin, right? Mm-hmm. It is in the synthetic folic acid form. It is not in the form our body can use, and it has to go through 5 steps to become methylfolate, or adding a methyl group, a carbon group onto the folate. So if the mom has one of the common SNPs, MTHFR, methylene tetrahydrofolate reductase, is a long name, but the long and short of it is it's one of the really common SNPs that we check for. If she has the one that decreases her ability to activate folate to between 10 and 30%, and she also has also has a detoxification SNP that helps her support her detoxification pathway. Now, this SNP is called cystathionine beta synthase, so it's CBS. And this is a B6 requiring, this is a vitamin B6 requiring enzyme. If the mom has both of those, and the baby has another real common SNP that affects how it can metabolize adrenaline, epinephrine, called a COMT. If the baby has the SNP that doesn't allow its COMT to function as well, and the mother has the SNP that doesn't allow her to activate folic acid as well, and also has the SNP that doesn't allow it to detoxify as well using the sulfur compounds that our body uses to help detoxify. If that happens, and the mom did not have enough of the methylation factors 3 months prior to conception, before the baby is even conceived, and 1 month after conception, usually before the mom even knows that she's pregnant, if there are not enough of the methylation factors, then that child has a 720% increased risk of autism. 7.2 times greater risk of autism. An explosion of autism if there's not this adequate methylation nutrition in that 4-month block. That study convinced us more than anything else to get very aggressive about our nutrition education, preconception, all the way through pregnancy. And what we focus on a few things. We focus on enough protein, so methionine and tyrosine, basically complete protein. So I'll rattle through those, but they're methionine and tyrosine and tryptophan and cysteine and arginine and phosphatidylcysteine. So phosphatidylserine. So these are all protein components that are key in all these different cycles. They have to have enough essential fatty acids, so enough DHA. Because DHA, one of the key omega-3 fatty acids, can help supply these methyl groups. They have to have enough magnesium. So enough magnesium to help convert from methionine to SAMe. People have often heard of SAMe. It's frequently used for depression. Or they have to have enough zinc, or they have to have enough phosphorus. They have to have enough of the vitamins, folate, as in folinic acid or methylfolate. They have to have enough B3, niacin, and B1 and B2 and B6 and B12, so your B vitamins. So one good way to get a lot of those antioxidants that help these pathways function and be protected so well is to get a rainbow of fruits and vegetables a day. So we emphasize a lot of grains. We emphasize eating a rainbow of fruits and vegetables a day. We emphasize getting enough B12 that helps prevent a lot of different neuro2 defects. We firmly emphasize not drinking alcohol during these portions of pregnancy. And we really get folks in a pretty aggressive nutrition program all the way through their pregnancy and all the way through the first months after the child's born to try to maximize how well these pathways work.
Mm. And these pathways, of course, and by the way, this has been very eloquent. You've taken us through a lot of information here. For some of us, we may not know a lot of these terms, but essentially what we're talking about here is having genetic variability in certain of these enzymes, right? And so we may need to have larger doses of nutrients through our food or supplements in order to help us so that we can make these pathways run better. So I'm curious, Dr. Stone, this whole issue with methylation and all of these different enzymes that you mentioned, the MTHFR, the CBNS, the COMT. So they're very important in fetal development, as you're describing, and can really lead to changes in the newborn. What about toxins as well? In terms of, as an adult, do we want these pathways to be running smoothly in order to get things like heavy metals and other intoxicants out of the body?
Well, we do. That's a great question. So if you look at your family history, do you have any family history of cancer? Do you have a family history of heart disease or stroke? Do you have a family history of blood clots? Do you have a family history of multiple adverse drug reactions? I just couldn't take any of those medications. Is there depression, anxiety, or schizophrenia? Is there dementia? Is there diabetes? Were there a lot of miscarriages? During the pregnancy, was there a lot of hypertension? Did anybody in your family have a neural tube defect, where they had spinal bifida? Or, if not in your family history, do you have any of those? Well, if you have any of those conditions, then you have to wonder, it's an open question. Do I require more of these molecules, these nutrients, because of my genes than what I'm getting? And also, what kind of things interact with the zinc and magnesium that are required for cofactors? So we think about lead. We know that lead and mercury affect methylation. So if you stand in front of the mirror and open your mouth and shine in a flashlight, and do you have a lot of silver fillings? And do you have a lot of infection in your mouth, periodontal disease? Is the pH of your saliva low? If it is, and you happen to have some of the nerve findings, then it could be some of the heavy metals. And it's these heavy metals that can raise your blood pressure. It's the heavy metals that can slow your ability to clear some of the toxins because it affects your methylation cycle. So, for example, if you have to have more of these B vitamins to have this methylation work, and you don't have enough, then you can't repair DNA damage from radiation. So you're more susceptible to skin cancer. You may have trouble making enough of the neurotransmitters, so you're more susceptible to anxiety or depression. So is that anxiety, depression because of heavy metals, or is it because of the heavy metal effect on your methylation and neurotransmitter cycle? So these are all open questions that you can begin to be a detective of your own in many ways and begin to pose the question. All of us live with ourselves 168 hours a week, yet we may only see a physician 15 or 20 minutes every 2 to 6 months. Well, we can do a lot of investigation before going to the master sifter of information, who is your physician. So I encourage all of us to look and contemplate more about what's happening with ourselves and our toxins, or our inability to have enough of these methylation nutrients. Are those affecting our health?
Mm-hmm. Well, and what you're saying is so pivotal. And to think that this methylation process in our body, like you mentioned, can tie into things like cardiovascular disease. It can tie into cancer. It can tie into depression, anxiety, so many processes. So it's almost like what you're saying about nutrition and these B vitamins. It seems like we all need to pay attention to this and to start getting more in the way of these B vitamins, whether through, again, a supplement or through food.
And I think, in all things balance, true? Mm-hmm. All things balance. So nature is phenomenally redundant, and it's all about balance. So there's the process of methylation. Well, another process is acetylation. So am I a person who, in my genetics, if I take B vitamins, do I get really anxious? Well, if that's the case, then I need to think about the other pathways that are involved in a different aspect of my detoxification. I have to think about how I begin to break things down, neurotransmitters down, that may be building up if for me, have take too many B vitamins. So I think often people talk about methylation or hear me talk about methylation partly because it's tied in with so many conditions, but I always try to bring in the balance. And so then you think about, okay, what's balance? Well, balance is better frequently through your diet choices than it is through taking handfuls of supplements. For example, those supplements can be very useful, and we use them all the time in practice. My contemplation point is, in a multivitamin, we may put beta carotene. That pigment that if you eat too many carrots, you turn yellow-orange, beta carotene. Well, there are over 600 carotenoids in nature. We're not going to be putting 600 different carotenoids in a single multivitamin. So, Deanna, you are an excellent, phenomenal teacher and instructor of phytonutrients and the power of color and the power of spices. And so I always say we use supplements as a bridge, and depending on your genetics and your health or illness, we may use supplements longer until we can get balance back in health and help restore health. So that's my general philosophy about it. Only being B vitamins, I want to bring in the balance of the things that we've talked about so far.
Oh, I think that's very well said. And I agree with you wholeheartedly. When we just take supplements, we could be missing out on the complexity of food and all of the different actives within food. When we start to isolate things and just take the active, we don't know what the response could be. And like you said, nature is such a great balancer. And so we're getting that checks and balances when we're eating good, healthy food. So Dr. Stone, if I were to have dinner with you and you were making me a meal to promote healthy methylation, what would we have on our plate?
That's a great question. I would have some form of good quality protein. Now that can be protein, complementary protein if you're vegetarian. So you think about the complementary protein of 3-to-1 ratio of legumes to rice or a grain, a quinoa. Has a good high protein level for a grain. Or I would have consider fish or even just egg white or egg. So frequently we will go with a high methionine food. So you want something to support the methionine cycle, the methylation cycle. So you're going to have some type of fish or egg, or you can use dairy if you don't have a sensitivity. We're going to go with some broccoli because they're high sulfur, or cauliflower. So it's usually a mixed vegetable component. Just the lightest of steaming, or if you're going to have it raw, that's fine. But the lightest of steaming. It may have a little bean sprouts, avocado. So what you're getting is some vegetables, even to a salad with a good protein source. If you want to get activated folate foods, they're going to be your greens. They're going to be as far as a plant source. So it can be turnip greens, it's going to be spinach. So our general feeling about food is if you want to get your minerals, you're going to have a good protein source and you're going to have your rainbow of vegetables. If you want to get your B vitamins, you're going to go with a lot of vegetables. And if you want to get your good complete protein, we've talked about those. So the other key thing for us is we don't do a lot of carbohydrates, a lot of flour-based carbohydrates, not a lot of breads, not a lot of pastas, because they change your B vitamin requirement. And then if you can't tell where it came from, then it's probably too processed. So we always like to say, if you can't recognize the food that's on your plate, the next time you make it, rethink the recipe.
Yeah, there you go.
That works for turkey tetrazzini from the dorm too, doesn't it? When we were all in college, that classic turkey tetrazzini on Friday was always a killer. What is in that anyway?
Yeah.
But I kind of summarize that. We have our patients go through a whole training on what to eat, and we often have handouts that will have thiamine, riboflavin, niacin, pictures of high B6 foods, your spinach, bell peppers, garlic, cauliflower. And what you see is a recurrent pattern. And you start recognizing, wow, in the top 10 foods that are rich in all these different things, folate, B6, thiamine, riboflavin, wow, they're repeated. And so suddenly you see that there's nature's banks. It's the nature's bank of vitamins and minerals that are so key in your methylation cycles.
Well, that's very inspiring. It's so great to think that we can that nature is gearing up these foods for us, that if we focus our energy on making sure that we concentrate our foods with foods that are nutrient dense and really making sure that we get those B vitamins, because B vitamins are pretty sensitive, right? They break down in heat, light, and oxygen. So we need to be sure that we're getting a constant stream of them because we're using them up so readily. Well, this has been great. All this information that you're giving us, Dr. Stone, is really fantastic. Everything from physical diagnosis to nutritional intervention for methylation. Just wondering if you had to summarize 3 main takeaways from everything you said to set the listeners on their way into an actionable path, what would be the 3 things that you would mention?
I would mention identify the last time you felt well and try to come up with a pattern, something that triggered the change. Secondly, look at your diet and see if it's rich in choline, or those foods that are rich in choline, eggs and fish, and is it rich in the B vitamin containing foods? Is it rich in essential fats? Because is it rich in minerals? If it's rich in those and you emphasize those, then you're going to support your methylation. Look at your family history, and do you have a lot of family history that has issues with heart disease or stroke or anxiety, depression, or cancer? If you do, then look closer at methylation. Look closer at things you can do to support your health and diminish your illness, and you will do well. And then take those to your provider and discuss it. Because you can turn on and off genes within 3 to 6 hours by what you eat, by what you do, by what you think, by how you sleep, how you move, and how you have relationship. And it's through understanding that we can change disease to health, and we can have very active, healthy lives and reverse our disease condition and improve our health condition. So with that, be well.
Again, this has been really wonderful and gives us so much hope as it relates to food, that we can really bring food, good, healthy food, into our everyday life so that we can be constantly dialoguing with our genes in a good, healthy way. Dr. Stone, did you want to mention any websites, perhaps your son's work on epigeneering? No, I didn't say that right. What's this word again that he has cleverly put together?
It's a combination of epigenetics and eating. So it's epigene eating, EPIGEN. Yes, what you eat changes your epigenetics, epigeneating.com. That's one. And then even our website, we have 2 nutritionists that work with us. Emily Ridbaum has been running the website for quite a while, and she puts on different recipes, ashlandmd.com. And between those 2, you get a pretty good idea. There's a new website that's coming out, growbaby.me, and that will have an ability to get some more information about what you can do to support your baby, that blessing to grow healthy through nutrition. Growbaby.me, epigeneating.com, or just visit us at ashlandmd.com.
So, and Dr. Michael and Leslie Stone are in Ashland, Oregon. So if you are local, and I've always said, Michael, that if I lived in Ashland, you'd be my physician. That's for sure. And who knows? I might one of these days.
It would be our pleasure.
Yeah,
there you go.
You're a wonderful person, big heart, incredible healer, and a very attentive, aware physician. And gosh, you brought so much to the whole area of functional medicine with your background. So thank you so much for being part of this summit and for inspiring us to change. So thank you again.
Absolutely. Blessings to you, and enjoy, everyone who's listening, enjoy your journey of getting better.